the end of this area here. Mental health is an important priority for the government. So the background to this is I used to also work in corrective services, which often served...
Is there anywhere the honourable member has not worked?
Not in your office, Honourable Minister. It was often seen as a repository for psychiatrically ill patients who had committed crimes, and the lament among the psychiatrists there was that there was no space in Graylands. Now, I appreciate Graylands is being reconfigured, and it is probably wise as well. So on notice, I would imagine, do we have any, could we have this broken down as to how this money will be spent and what is the plans for Graylands, and can we look at taking some of the pressure off corrective services where the mentally ill psychotic patients, prisoners, are actually treated medically rather than actually correctively?
I'll get the Director-General to make some comments, and if there's something specific that we need to follow up by providing it as supplementary, I'm happy to do that.
Thank you, through the Minister. So the line item that you refer to, Honourable Member, is the really relates to the Graylands Reconfiguration and Forensics Task Force, or GRAFT. So I'll refer to GRAFT as the acronym. But it's another health acronym, and I apologise. But GRAFT in an estimates budget hearing is probably. Sorry, I'll try not to use that then, Minister. So the planning for Graylands has been ongoing for some time, but Graylands, as the sole tertiary facility or sole major tertiary facility, really in WA, any planning has to consider where we would put our step-down facilities, be they secure units, be they also community care units, and also treatment in the community. So the planning has, anything I talk about here, the planning has not been done in isolation, just looking at the forensic services on their own. It's been done at a whole of system. The task force was established by this government, and it has been working through a whole suite of planning for Graylands and anything that sort of is related to Graylands. The $10 million is therefore a very robust business case to go to the 23-24 budget, with a focus initially on the forensics part of it. As the Honourable Member says, the acute forensics part of Graylands is around about 30 beds and has been 30 beds for some time. We have provided over the years more in-reach into prisons and also into the community from the psychiatrists and the mental health teams that are situated at Graylands who actually go and visit the community. But there is a need for an expansion of forensic services either at Graylands or at another site. There is already there is already forensics at Graylands. There is the space there, and an intention to actually expand the forensic unit there as part of this broader business case. We have also at the same time looked at the configuration of services at Graylands. When Graylands was built, it was when I was a clinical doctor, it was very different to where we actually have to treat patients now, and should treat patients now. They should be treated in the community. They should be treated much closer to home, to their local hospital, and that's why we're looking at the investment of the secure units that are not just in one site such as Graylands, but are actually in sites such as Osborne Park, Bentley, Rockingham, and indeed we have now an acute psychiatric unit at Broome, for example. So there has been a lot of investment. This is taking it to the next level. So we're also looking at the reconfiguration of Graylands. There's a lot of old buildings to the southwest, on the southwest corner of Graylands. I hope I've got that right, but it's definitely the south of the Graylands site, that could be potentially consolidated in the main Graylands site, and we could also build more appropriate and contemporary services at Graylands to serve the local community. So the work that has been done this year, which is under the chairmanship of Jim McGinty, who's the chair of the task force, has actually been looking at the whole suite of what we require in mental health, but with the focus being very much on justice and on forensic mental health initially.
Thank you.